Welcome to Thursday's edition of COVID-19. Korea's daily tally has marked little change from the day prior and is hovering on the 500 level today. Meanwhile, President Moon Jae-in's diplomatic agenda in Europe has just come to an end, and we have details later on the program. Here first is the broader pandemic coverage with our Kwon So-ah. Now, So-ah, what is the latest here on the local front for this Thursday?
Well, Sunny, we've just got a tiny drop in COVID-19 infections this Thursday to 540 as of 12 a.m. And that includes 523 domestic cases and 17 from abroad. So with that, Korea's total caseload of COVID-19 infections is expected to surpass 150,000 by Friday. And if we go over to our map now, we do see again in the capital Seoul over 200 infections, followed by more than 180 in Gyeonggi-do province. And it is good to see that many places across the country now are reporting just single-digit figures of new infections, but still all districts or provinces are being affected this Thursday with new infections. And in the past 2 days, we've been seeing cases in the 500s rise from the 300s we had before. But if we compare the figure to last Thursday, we are seeing an on-week drop. And let's also get an update on the vaccination front. We've got almost 13.8 million people in the country who have received at least one dose of COVID-19 vaccine, and that's equivalent to around 26.9% of the nation's population. And beginning this Thursday, citizens are being administered with the Moderna vaccine, which is now the fourth COVID-19 vaccine to be rolled out here in the country. And the final green light for the U.S. vaccine was given by Korea's Food and Drug Administration on Wednesday, with the first 55,000 doses of the vaccine having arrived earlier this month. Medical workers aged under 30 will be subject to Moderna inoculations, which require 2 shots for full vaccination. The initial AstraZeneca vaccination schedule for this group was postponed from the first quarter of the year over blood clotting concerns, and that's why they are now receiving Moderna jabs.
I see. And over in Europe, so I understand some countries are easing restrictions earlier than expected, and others are calling for mandatory vaccination.
Right, Sunny. First off, France is lifting its night curfew on Sunday. That's 10 days earlier than initially planned, and that over declining COVID-19 figures. Also, beginning Thursday, wearing of face masks will not be mandatory anymore outdoors. And in Russia's capital, Moscow, meanwhile, service industry workers have been ordered to get vaccinated over a slow rollout and a surge in infections, despite Russia being the maker of the Sputnik V vaccine, which was the first registered COVID-19 vaccine. Let's also get a check on the numbers abroad. Let's start with Russia here at 5.2 million infections in total. Russia is reporting over 13,300 infections in the past day, while France, as I mentioned, is now returning to normal with 5.7 million cases in total, around 3,000 infections in the past 24 hours there. Meanwhile, we are seeing resurgences in Brazil with over 85,000 cases reported in the past day, and that's more than India is now reporting. Let's move over to the countries with the highest numbers of fatalities in total. The U.S. followed by Brazil, India, Mexico, and Peru here, all over 189,000 fatalities in total. And the total number across the globe here, we've got over 3.8 million fatalities and a total of 177.8 million infections. And those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for now. Meanwhile, the presence of vaccines is indeed serving to boost our inoculation numbers. And for more on the pace of our campaign here in the country, I have our Chae Won-jung in the studio with me. Welcome, Won-jung.
Good afternoon.
Right, now let's begin with the speed of our inoculation drive then.
Right, so I visited 2 vaccination centers this week. And let me tell you, the sites are becoming increasingly busy because many people are looking forward to getting the vaccine as soon as possible. And we met 2 people at the center. Let's take a listen.
Our officers have a lot of face-to-face work, like dealing with intoxicated people and visiting people's homes, and often meet others who are not wearing their masks. I used to get anxious while on duty, but if I get the vaccine, everyone will be much safer.
I'm a dental hygienist, meaning I work with a lot of patients who take off their masks. Despite vaccine side effects on the news, I personally wanted to get the vaccine as soon as possible. I hope more people get vaccinated voluntarily to end this pandemic.
And we also stopped by other medical facilities in Seoul, Gangnam-gu district. I was amazed by the number of people who were waiting in hospital to get surplus COVID-19 vaccines that they can reserve through mobile apps such as Kakao, Naver. And now the workers at one hospital told me that they have been flooded with phone calls, and some people are calling multiple times a day to double check if they booked their appointments correctly. Now they told me that this was something they had to do.
It is a national disaster. An economic downturn worse than the IMF crisis is affecting our country. It's not just me. A lot of doctors are also trying to find leftover vaccines. Our country is in a serious situation just by looking at the increasing prescriptions for depression, anxiety, and sleep disorders.
I see. Now, before you go, what more can you tell us about plans to ease audience limits at sporting venues, I understand, and concert halls?
Right, so this is very, very exciting news for many sports fans in South Korea. Starting Monday, more fans are allowed to be inside the sports stadiums. Now, under level 2 social distancing stadiums are allowed to fill their seats to 30% of their total capacity. Now, for 1.5 seat distancing, the limit is higher at 50%. People are still not allowed to eat or drink in their seats, unfortunately, nor cheer very loudly. However, fans are still excited about the new measures.
It's this guy's birthday, so I gave it a shot online to get a ticket, and luckily, because of the expansion to 30%, I got a seat.
It's true that it's not as fun as before because we can't yell or cheer, but it has its own beauty.
Right, another great news for concert goers in the nation, with up to 4,000 people being allowed to attend concerts and shows, which is a big jump from the previous limit of 100 people. Now, these new measures are expected to help people to get back somewhat to normal lives for maybe this summer.
Hopefully, I'll keep my fingers crossed for that. All right, Wonjong, thank you very much for the coverage.
And thanks for having me.
Right, we are now poised to join the regular briefing on the COVID-19 situation here in Korea for this Thursday. Given the rise in cluster infections at indoor venues, authorities are reiterating that is, calls for regular ventilation of air-conditioned and closed spaces to limit the transmission of COVID-19. Now, while we wait for the briefing to start, let's also take a look at the incentives for those who have received at least one dose of the COVID-19 vaccine and have witnessed the passing of at least 2 weeks. First, these individuals are excluded from the cap of 8 people for family gatherings. This means any family member who has received at least one dose at least 2 weeks prior will be exempted from the head count of 8 people for family events. Secondly, access to senior welfare and activity centres is allowed, also for those fully vaccinated. Recreational programs such as singing classes is permitted, as is the sharing of meals. And in-person visits to nursing homes is possible if one party is fully vaccinated. However, at nursing homes where the vaccination rate for the first dose stands at below 75%, a negative PCR test will also be required. Prior reservations are necessary and no eating nor drinking is allowed during these face-to-face meetings at nursing homes. Also, face masks remain mandatory. Meanwhile, those fully vaccinated and working at high-risk facilities such as nursing homes will also be exempted from the regular mandatory screening requirement, which reportedly takes place at least once a week. Other incentives include entrance discounts or even fee waivers at concert halls and national parks. And come July, those who have received the first dose can go mask-free when outdoors. The briefing has yet to start, so let's now take a look at the possible discomforts after COVID-19 vaccination. Common side effects include pain at the site of injection, fatigue and headaches. So with regard to ways to minimize discomfort, here are a few natural remedies. Try applying a cold cloth or pack on the injection site, or try gently moving your vaccinated arm to stimulate blood flow to disperse the local area of inflammation. For those suffering from fatigue, get some rest, while for fever, drink plenty of water. If you need to take a painkiller, doctors recommend medication that includes acetaminophen. Thirdly, should your discomfort worsen, be sure to dial 119 for guidance. We continue to wait for the briefing to begin, so here now are the social distancing guidelines in place until the 4th of July. Level 2 measures for the Greater Seoul area as well as the southern resort island of Jeju. The rest of the country, aside from them, faces level 1.5 social distancing. The ban on gatherings remains in place, with 5 or more people not permitted to meet for social purposes, but with exceptions for immediate family members. The briefing is about to start. We'll come back to you afterwards.
First of all, we have Commissioner Chung Eun-kyung with the briefing.
Good afternoon, ladies and gentlemen. I am the Commissioner of the KDCA, and let us now begin our regular briefing for today, June 17th. First of all, on the vaccination front, here are some updates. Thanks to your continued participation, we have also surpassed 14 million people in terms of the number of people who have received their first dose. And as of today noon, we have about more than 14 million people receiving their first dose. And we have been rolling out the vaccines since late February, and we have achieved our goal for the first half of this year in just 162 days. And by age group, as of today noon, we also have about 88% for those over the age of 80, and also 73% for those in the 70s as well. And as for all of the people who have been participating in our inoculation drive, I extend my deepest appreciation to you all, and also my thanks go out to all of the healthcare providers as well as volunteers and all of the public servants who are working at the forefront. And we have now reached about 24% of the total population getting inoculated, and this is 1 out of every 4 people. And we have high hopes to return to a state of normalcy. However, at today's state, that is, we can reduce the risk of infection. However, we are not there at the stage where we can protect ourselves from the infections of COVID-19. So until we reach a herd immunity, it is very crucial that we wear a face mask and also continue to carry out regular ventilation and also get tested as soon as possible if you have any clinical symptoms. And next, we also have some plans for June as for those who have not been vaccinated yet. And right now, we are rolling out the vaccines to seniors between the age of 64 and 74, and we also have about 130,000 who have been overbooked, and we have 90 people who have cancelled their vaccines right now. And according to the supply of the vaccines, we will be making sure that we will be identifying the exact number of these overbookings of these senior citizens. And until June 19th, we will make sure to accumulate the exact data and figures for those who have cancelled their reservations. And as for next week, we will be providing these notices to those who have booked the vaccines in an individual and a personal manner. However, if you have not booked for your vaccine in advance, you are not eligible for this vaccination. And right now, we also have the efficacy of the vaccines being tested. And as for those over the age of 60, we have been looking at the efficacy rate, and with just a single dose, we can protect ourselves up to 84%. And by vaccine type, AstraZeneca is 79%, and Pfizer is 86% effective, and we also have 100% efficacy in preventing fatalities. And also at senior facilities, we looked at 8 facilities where they had the cluster infections even after the inoculation. We were able to protect and prevent fatalities by 100%. And we also had the efficacy of the vaccines up by 81%. And by these facilities, we have seen Alpha new variant and also Delta variant at different facilities. And we have looked at the efficacy rates of these 3 facilities, and at all of these facilities, we had over 80% efficacy rate being confirmed. And as of today, we have also completed the supply of more than 17 million doses of vaccines. And during the first half of this year, we are planning to also be supplied with a total of 18 million doses. And as for AstraZeneca vaccines, we also, under the COVAX vaccines, we also have certain doses that are scheduled to arrive. However, this has been delayed to the latter half of this year, that is Q3, and this is because the COVAX facility has been looking at the countries with a lack of vaccines, and they have also notified us of a change in the schedule of such supply. And as for Moderna vaccines, we have also 55,000 vaccines, another batch. This is the second batch to be arrived here in Korea as well. And the Janssen vaccines as well, they will also arrive in July as well. And Novavax, we are undergoing the approval process by the Ministry of Food and Drug Safety, and our approval is expected for Q3. And we also have about 80 million doses of the vaccine doses to be supplied in Q3, and they include AstraZeneca, Pfizer, Janssen, and Moderna vaccines. And we believe that we will have 17 million doses to be arrived very soon. And as for the details, we will be releasing them as soon as possible, depending on the contract with the individual pharmaceutical companies. And here are also our updates for the Q3 vaccination plan. Our goal is to inoculate more than 36 million people, which is over 70% of our total population by September. And the eligible recipient is adults above the age of 18. And also, in accordance to our plan that has been disclosed earlier, our principle is based on our goal has been based on the principle. And also, we have had the rounds of the screening process by our experts committee. And in the first half of this year, we aim to inoculate especially senior citizens as well as other high priority group. And we believe that this was aimed at reducing the number of fatality rate as well as reducing the number of critically ill patients, that is. And also the COVID-19 vaccine rollout has been beginning here in South Korea starting from the 26th of February, beginning with the residents and workers at long-term care centers. And we have also achieved great milestones. And today we have surpassed our goal of 14 million within the first half of this year. And as for the Q3 vaccination plans, here are details. We have about 22 million people to be inoculated, and we aim to inoculate an accumulated of 36 million. And by summer break, during summer break, that is, we want to complete the vaccination for faculty members at primary schools and also kindergartens and also other age group as well. And we also aim to inoculate high school seniors as well. And considering the infection rate of the COVID-19, we also will be vaccinating those in their 50s first during July and also August. And as for those with mobility difficulties and also the homeless people and also those people with other difficulties and disabilities who are currently in the blind areas of these vaccination and reservations, we will be focusing on them as well. And going forward, we will also expand our capacity rate of inoculation by designating more hospitals that can able to roll out the Pfizer vaccines. And also we will enhance the level of comfort and also convenience and access for the vaccination centers. And also, we will have a very great cycle among these vaccination rollouts. And we also have detailed plans for Q3. By 16th of June, we also have those people between the age of 64 and 74 who have not yet been vaccinated. And we will be vaccinating them first during the first few weeks of July. And also as for the social welfare workers who have not yet been inoculated, we will also provide them with the vaccines as soon as possible in July. And as for the students, high school senior students, and also other students, we will also provide the vaccines starting from the 19th of July, and they are those who have been giving the consent of the vaccines. And aside from the high school seniors, those who are taking the college entrance exam, we will be securing the full list by July, and we will be rolling out the vaccines to them in August. And as for the teachers at primary schools and kindergartens and pre-K as well as high schools, we will also begin with the Pfizer and Moderna vaccines starting from 26th of July. And originally we had planned to provide the vaccines for the preschools and kindergarten and also primary schools in June. However, they have been shifted to July, and they will also be given out the vaccines in accordance to that schedule. And as for the 50s, we will be starting the inoculation starting from July 26th, and in advance we will receive the bookings for the vaccines, and we will be beginning the vaccination booking process for those between the age of 55 and 59, and also this will be lowered to 54 and 50 as well. And those under the age of 40, we will also provide the vaccines starting from August, starting from the people who are willing to get vaccinated. And as for the people who need special care and consideration due to physical mobilities, we will be also providing our tailored accessibility schedules. And as for those with disabilities who have mobility difficulties, and also those with mental disorders, and also those seniors with mobility difficulties as well, we will be looking into providing tailored vaccination plans for these groups of people. And by region, we will consider the specifications and features of each region, and in order to boost the level of convenience, we will also cooperate fully with the local governments. And considering the local infection rate as well as the local medical systems, we will be looking at the high-risk group there within those regional places as well. And depending on the local government's discretion, we will also provide them more authority in deciding their eligible recipients. And after the end of July, depending on our schedule of supply, we will be devising more detailed plans. And also, in order to boost the level of accessibility for these business operations that need also vaccinations, especially that run 24/7, including shipbuilders as well as the steel-making companies, we will also make sure that they get vaccinated starting from August as well. And next, as for the AstraZeneca vaccines, we also have some people who are scheduled to receive their second dose in July. And originally, under the COVAX vaccines, we also received 830,000 vaccines. However, this has been delayed to July. And as for these certain number of people who are subject to the second dose, they will be given the Pfizer vaccines for their second dose. And this is according to our screening done and approval done by the experts committee. And it is the principle to provide AstraZeneca vaccines to those who have received the same vaccines for the first dose. However, we decided that there could also be possibilities of cross-injection, and considering especially the research and the studies done overseas, and we have seen that it is also possible to increase the amount of immunity, and we also have the results that prove that these cross-injections also increase the level of immunity as well. And therefore, as for the AstraZeneca vaccine recipients, we are also providing temporarily the second dose for this group of people in July, and they will be injected with the Pfizer vaccines. However, if you are willing to specifically receive the AstraZeneca vaccines for your second dose, we will be devising detailed plans for these group of people as well. And the inoculation plan for the second dose will be carried out after 10 to 12 weeks after the inoculation of the first dose. And after the month of August, we also have more people who will be subject to the second dose. And these details, we will be detailing them depending on our schedule of the vaccine arrival. arrival, as well as further research. And we also want to extend our deepest appreciation once again to the members of the public and the medical professionals and many other people who have made it possible for us to reach our goal 2 weeks in advance. And also going forward in the latter half, we will also be fully prepared to provide safe vaccines, and we will aim to reach herd immunity by November. And if you are eligible recipients, we ask you to participate in the rollout as well. Thank you very much.
Right, that was Chong Young with Thursday's afternoon briefing. So what did she have to say?
Well, as was predicted, Tong has announced the government's inoculation plan for the third quarter, and this coming on the day when we have reached another milestone of 14 million people who have received at least one shot of COVID-19 vaccination. And Tong stressed, however, that although a quarter of the nation's population has received that first at least one shot, that does not mean that community spreads of the virus can be contained, but it does mean that infections and deaths can be reduced. Now let's take a brief look at what the third quarter will entail. The government is planning to inoculate 36 million people until September when it comes to receiving at least one dose, and that will include people aged between 18 and 59. So it will start with people aged in the 50s, and among those aged 55 to 59. So that's expected to begin in late July. And also instructors and teachers at various education facilities will be prioritized, as well as high school seniors. And their vaccination is expected to start on July 19th, and they are going to receive the Pfizer vaccine. Also, the commissioner of the KDCA has stressed that people with mobility difficulties, for instance, or homeless people who have difficulties in making reservations for vaccination, the government is going to provide extra measures for them as well.
I see. All right. Well, we'll have more details on that on Friday then. Thank you very much, Soa.
Thank you.
Nutzung von Daten in ganz einem anderen Ausmaß, als das in Europa möglich und auch üblich ist. Und das ist sicherlich etwas, wo wir im Detail noch darüber sprechen sollten, weil man in Korea gesehen hat.
기후변화 대응과 녹색 회복, 4차 산업혁명 같은 미래를 향한 공동과제에 함께 협력하길 원합니다.
Diplomacy continues amid COVID-19. Following the Group of Seven summit in the UK this past weekend, President Moon Jae-in met with his Austrian and Spanish counterparts in their respective countries. Now, for more on these exchanges, I have Professor Chung So-young from Korea University. It's a pleasure to have you back, Professor Chung.
Thank you very much for having me here today.
Right, and joining the session virtually is Johannes Pleschberger, a freelance journalist based in Austria. Good to have you with us, Johannes.
Hello.
And I also have Lily Mayers, a freelance journalist based in Spain, live on the line. It's a pleasure to have you with us, Lily.
Thank you, Sunny.
Right, then we'll start here in the studio. Professor Chung, let's begin with your assessment of President Moon's agenda in Europe.
Well, I think biggest achievements in his trip to Europe this time is to having him coming back to the normal interaction with European leaders based on the face-to-face relationship. It's no doubt for us to say that having a face-to-face meeting to discuss about the sensitive and important matters in this at this time that talking about the health and then climate change and some other matters are extremely important. And we already have a good evidence by looking at his achievements in the recent trip to the United States, having the good discussions with President Biden and the U.S. private sector leaders.
Right. Johannes, President Moon's visit to Austria was the first by a Korean leader since the two nations established ties back in the year 1892. What has been the response in Austria to this state call?
Yes, as you mentioned as you have mentioned, the diplomatic ties were established in 1892, and back then Austria was actually the Austrian-Hungarian Empire, and South Korea was the Kingdom of Korea, so some time has passed. And this is also why many Austrians were very curious about this first state visit. And the Austrian president, Alexander von der Bellen, has been calling South Korea a world champion in fighting and coping with the corona pandemic. And also that South Korea has survived it without major economic collateral damage. However, we have to add that South Korea, one can say, is almost an island, especially compared to a country like Austria, which has so many neighboring countries. So the situation has been quite different.
Right, it has. Meanwhile, Lily, I believe President Moon's state visit to Spain was the first by a foreign leader since the pandemic began. What was the reaction there?
That's right. And I think because of that, it felt quite momentous. And it's something even President Moon mentioned was a great honor for him. I think for the Spanish government and for the royal family, like the professor said, that face-to-face contact was so important to rehab, and especially with such a close friend of Spain. It's also been a continuation of celebrations marking the 70th anniversary of the establishment of diplomatic relations between Spain and South Korea. So, as you can imagine, there were a lot of messages from both sides about strengthening and maintaining the relationship and acknowledging a mutual gratitude for the close ties between the two countries.
Right, and along with what Lily has just said, Professor Zhang, the leaders also, both of them that is, from Austria and in Spain, reportedly spoke highly of Korea's COVID-19 strategy. What role do you believe this strategy has played perhaps in boosting the country's standing, so to speak, in the international stage?
Well, it is no doubt to say that it helped Korea to boost up its stance in the international scene a lot. We can still think about what Korea showed in the last year's G20 meeting, where President Moon first revealed Korea's plans how to effectively address the COVID-19. And he also, at the time, stressed the equal share access to the vaccination for the developing world. I think these are some of the important issues that currently all the leaders in the world are discussing about. And then there is a continuity for the Korea actually to add some other issues that, in his recent visit, that becoming a production hub of the vaccine. Also, stressing the importance of the climate change by hosting the recent P4G summit meeting. So it became a very, very good platform for Korea to play an important role in the international arena.
Right, and staying with that, Johannes, Korea and Austria saw eye to eye on the importance of a unified front against COVID-19. Now, what forms of bilateral efforts do you envision to this end?
So actually, the bilateral cooperation between Austria and South Korea has already deepened last year in order to jointly fight the virus. So information has been exchanged in 2020. But we have to add that what also Chancellor Sebastian Kurz, we heard the quote before in the video prior to the discussion. He has said that Korea has been able to draw on health data to successfully combat the pandemic in a way that was not possible in Europe. So this topic will definitely still be discussed here. And in addition, the two countries have agreed to strive for joint basic research in the fields of energy and biosciences, among other things. And actually, the Korean ambassador to Vienna has talked about a so-called fourth industrial revolution with a mix of Korean expertise in industrialization and commercialization and Austrian competitiveness in basic research.
Right. Meanwhile, in Spain, Lily, President Moon and Spanish Prime Minister Pedro Sanchez touched upon ongoing efforts against COVID-19 and bilateral economic interests. What more can you tell us?
Well, the two leaders signed 2 agreements and 5 MOUs. So over the last 3 days, they've been very busy. Each one of those agreements is designed to transform the cooperation between Spain and South Korea into a more strategic plan, as President Moon put it. The agreements cover industrial digitization and improved technological collaboration in energy. Both leaders also want a focus on renewable energy issues like achieving carbon neutrality by 2050 and improving sustainable agriculture. Essentially, both leaders want to see improvements in new technologies that then lead to the creation of new jobs and therefore help both become more sustainable economies. And they believe they can do that by having a sort of better together attitude and a commitment to sharing ideas and research and insights that will help achieve that. In terms of health, both leaders agreed to cooperate in public health and disease prevention, and in particular to lessen the disparity of available COVID vaccines around the world, but they didn't give a great amount of detail as to how they exactly would go about doing that.
Right. Professor Zhang, as you mentioned, President Moon is known to have touched upon common challenges for the globe, including climate change and green growth, during his Europe agenda. Do tell us a bit about the importance of global collaboration in tackling these tasks.
Well, tackling the climate change, for instance, it cannot be done by any single country in the world. That given the scale of the impact of the climate change, also the solutions that we need to look for, and then the timing, that the time that we have, it's an immediate threat. So we need to have orchestrated efforts to address all these matters all together, not only by the countries though, actually with private sectors and other stakeholders as well. So it's one single global problem, therefore countries must work together. And then these days, climate change has been also related closely with, as we just said today, the health and the digital matters. And then other matters also needs to be coordinated, and this can only be done by the global cooperation.
Right, and talking about matters, Johannes, beyond the pandemic, what appear to be some of the other areas of mutual interest for Korea and Austria?
So beyond the pandemic, the two countries have signed an agreement on closer cultural cooperation. They have also mentioned the philharmonics of both countries and a double taxation agreement. There are various agreements that could still be made. There's also still potential for bilateral improvement in expanding the volume of trade, for example. But for some time now, there has also been speculation about the possible role for the Austrian capital of Vienna in getting the nuclear talks with North Korea back on track. So Vienna does like to present itself as an international neutral place for talks, for negotiation, and the preconditions for this would be actually given. Vienna is the seat of the UN Atomic Energy Agency and recently proved its role as a host for the Iran talks. Plus, North Korea maintains an embassy in Vienna with the best wires directly to Kim Jong-un. So this could be an interesting idea presented by Austria, and we will see what will take place.
Right, Johannes, that actually is a possibility right there. And staying with mutual interests, Lily, what do you suppose are some of the strategic partnerships that Spain would perhaps like to advance with Korea?
Well, there are a couple. I think most importantly, both leaders acknowledged the importance of recovering trade to pre-pandemic levels. They also agreed in the future to expand their cooperation in Ibero-America in areas of infrastructure, education, the digital sphere, and the green economy. And I think what's also interesting and of note is that cultural exchange was another potential area for focus in the future. In particular, the promotion of Spanish languages in Korea and Korean language in Spain, and also a promotion in exchange programs for students and teachers.
Right. Meanwhile, back on the pandemic front, Professor Zhang, what are your thoughts on Korea's efforts to promote its vaccine production hub vision during this particular Europe trip?
Well, Korea started to lead the global efforts to address the pandemic by emphasizing effectively handling the COVID-19. Then now, President Moon emphasized the importance of the Korea's role in terms of becoming the hub of the production of the vaccine. Actually, there is a very continuous efforts in this context. Even he achieved the first thing in the United States once again through face-to-face, the bilateral interaction with President Biden. Now here in Europe, he furthered actually talking about becoming a hub of a most advanced possibly type of the vaccine in Korea. And this is also possible because not only the leadership of the Korean government, also the Korea has a very world scale, world level of the companies who have capabilities to produce all these products available. So it's a good combination of the public-private partnership.
Right, it is. Lily, Korea and Spain are also looking at the possibility of setting up a travel bubble. Now, how does this movement of people look to affect perhaps bilateral interactions?
Well, it would be a really great thing on multiple fronts, a travel hub between Spain and South Korea. There are new direct air connections between the two countries, so it feels like a plausible plan. Spain's economy desperately needs to recoup some of those tourism dollars that have been lost during COVID. And we know before the pandemic in 2019, around 630,000 Koreans visited Spain. So it's clear there's an appeal there for tourism. Also, any measure that better facilitates private business between the two countries is very much in line with these new bilateral priorities that have been announced. So I think if the two countries did manage to work out this travel bubble, it would only further build the diplomatic ties and bring the two countries together.
Right. And Johannes, what are the entry protocols for Koreans seeking to fly into Austria, and what needs to be done to perhaps facilitate such exchanges between the two countries?
So Koreans can visit Austria also for purposes of tourism. All they need is either a certificate for a vaccination, or they need to have a certificate for having recovered, or an antigen or PCR test. On the other side, Austrians currently are not allowed to visit South Korea except for if they have a visa, which wasn't the case before the pandemic, but now it has been introduced. And but yes, tourism is on the rise again, and also business visits. Anything can happen. Austria follows this procedure of the 3 possibilities to enter, either via certificate of vaccination, recovery, or test.
I see. Professor Chang, what efforts need to be made going forward to perhaps strengthen Korea's diplomatic clout in the global arena?
Well, quickly on the health matters, Korea needs to strengthen its capability more on the aspect of the R&D of the vaccine. I think this is the next thing that Korea needs to focus on. On the climate area, we need to produce the tangible outcomes at the domestic level in terms of reducing greenhouse gas emissions, also boosting the economy again. At the international level, I would suggest that working closely with the global scale of international organizations in Korea, such as the Global Green Growth Institute and the Green Climate Fund. I think these are some of the things that Korea must do further.
I see. All right. Well, Professor Chung, as always, thank you very much for your insights. Johannes, thank you very much for your time at this very early hour. And same to you, Lily. Thank you for your thoughts.
Thank you.
Right then.
Thank you.
Cluster infections persist in daily settings, so do seek to remain vigilant and remember to frequently ventilate your indoor spaces. Thank you for watching.